The Show Me a Brighter Future campaign supporting Proposition B ended its statewide bus tour with a rally in the Capitol Rotunda in Jefferson City on Friday, October 12th. Liz and I interviewed two Proposition B supporters after the rally.
In just a minute, I will be interviewing Warren Erdman of the Missouri Board of Curators, and we'll be talking about Proposition B and its effect on higher education in the state. Okay, if Proposition B is passed, what kind of effects will the legislation have on education?
Well, first and foremost, half of the money will go to our public schools where it's badly needed. Missouri has not fully funded its commitment to the public schools, and half of the proceeds of this will go to the public schools. 30% will go to public higher education, including the University of Missouri. For the past 3 years, Missouri, the university and public higher education have been cut in their funding, and this would help offset some of those cuts. 20% would go to public health expenditures to get us to the CDC recommended levels of spending on prevention and cessation of tobacco use.
Yes, and the tax has been on the ballot twice before, and I was wondering, have you always been in support of this tax?
This is a completely different proposal from the prior two. This time, the proceeds from the tax will go to public schools and public health. The last two times, the proceeds of the tax were going to go for Medicaid expenditures at Missouri hospitals. So they're completely different proposals.
Okay, and what made you decide this time to be in favor of Proposition B? Is it because of your education background and the fact that the proceeds and the benefits are going towards education?
I think the primary reason that I'm very motivated by this is you have to ask yourself, why is the state unable to fund public education? And the reason is because all of our revenue growth is being used in Medicaid expenditures that are largely tobacco-related illness. And yet, we subsidize that tobacco use with the lowest in the nation tobacco tax. So on the one hand, we're encouraging people to smoke with the lowest in the nation tobacco tax, and on the other hand, our Medicaid tobacco-related illness expenditures are going up, and as a result, there's no money for public education.
Why should Missouri voters care about this proposition?
Because if we don't do something about this situation, state spending on tobacco-related illness will continue to grow. And as we spend more on tobacco-related illness, there's less money available for public schools and higher education. If we can't fund public schools and higher education, then our job training skills will reduce and our economy will go down. So we have to do something about this. We can't simply allow this subsidized tobacco use continue to exist in our state.
And how much of the benefits and the revenue from the tax will be going to higher education?
About 30% of the revenue that's raised, the revenue has been estimated annually between $283 million and $423 million. So for easy figuring, say $300 million, about $100 million a year would go to higher education, about $150 million would go to the public schools, and the rest to public health.
And as a member of the Board of Curators, what kind of things would the extra revenue that is going towards higher education with the universities and the colleges, where would this money be going specifically?
Well, it could be used in a variety of areas, but first and foremost, we need to be training more healthcare providers in our state, more doctors, more nurses, more caregivers. One of the immediate things that Proposition B would allow us to do is to fund an expansion of our medical school, to train more doctors, to allow more clinical practice, to increase the number of caregivers. As the baby boomers age and move into retirement, we're going to need these caregivers, and if we don't start training them now, we'll have a shortage of these vital caregivers in the years ahead.
Are you targeting any specific areas in the state of Missouri, any specific regions within the state that are more susceptible to be against the tax or for the tax?
It's a statewide campaign. The benefits of this proposition will go to all Missourians, no matter where you may live. The healthcare professional training initiative that I just spoke about is particularly of importance to rural Missourians because many rural Missourians are simply underserved for healthcare. So I would say that all Missourians will benefit, but in terms of the healthcare professional training that Proposition B would allow, they may benefit the most.
And how far-reaching has this campaign gone so far? Do you think you're really reaching out to the people in those rural regions?
We just finished a 23 community bus tour, and most of those communities are in rural Missouri. So the campaign is aggressively campaigning in all corners of the state, both urban, rural, and suburban. And we've been in just all across every region of the state, and I think the statewide campaign should produce a statewide victory.
And I was just going to say, can you comment on really your outlook on the success of the campaign as a whole?
Well, we're very encouraged. People understand this need. They realize that it's time we do something about it. And I think the indications are that our message is being received, and we look forward to a win and getting on with the business of addressing our healthcare needs, our public education needs, trying to lower our spending on tobacco-related Medicaid.
Well, thank you very much for your time and your answers to my questions.
Okay,
Thank you.
I spoke with Misty Snodgrass, the Government Relations Director for the American Cancer Society, as well as a spokesperson for Show Me a Brighter Future.
Why is it so important that Missouri raises their tax on tobacco?
We think it's important for numerous reasons. We think it's a win-win because it provides much-needed revenue to local public schools, it keeps kids from ever starting to smoke, and it saves lives.
What is the average state tobacco tax?
The average national average is $1.49, so we're at 17 cents and we're the lowest in the country.
If approved, Proposition B would bring an estimated $283 million to $423 million a year to the state of Missouri, according to an estimate from the state auditor. What will these extra funds benefit?
50% of those funds would go towards local public schools. So every public school district in the state of Missouri would receive money. And it's significant enough that almost every school district could actually hire at least one teacher. So even in the smallest school districts, they'll be able to fill this. 30% of it will go towards colleges and public universities. And it will help provide training for the future workforce of tomorrow. And then 20%, which is near and dear to our hearts, will go towards tobacco prevention and cessation.
What kind of smoking cessation programs will be funded?
One would be a Medicaid cessation for people that are on Medicaid. We spend $532 million on Medicaid per year related to tobacco, illness, and disease. So that would be one portion of it. It also would go towards our quit line. We currently do not fund our quit line in the state of Missouri, so it would help all Missourians be able to quit, the 1-800-QUIT-NOW number.
Okay, so you've mentioned that the smoking and smoking-related expenses cost Missourians like billions of dollars annually. What effects will this proposition have on citizens who aren't affiliated with education or don't need smoking cessation services?
It will help everyone. Every school district in the state of Missouri will feel the benefits of this. It'll also help our economy because we'll be able to hire more teachers, we'll be able to hire university faculty. There's all sorts of things that can be a benefit. So there's not only is it going to be benefit directly to those school districts, but our entire state will feel that as well.
There is some controversy surrounding this tax, as some people believe they are not getting the whole truth. In your opinion, what is the true reason for this tax?
The true reason is pretty simple. It's to help keep kids from ever starting to smoke and to save lives. That's why we're invested in it. It also has a side benefit. By increasing it, you get additional revenue, and that will go towards local public schools, so it helps provide the funding for that as well.
Do you think that this tax will negatively affect franchises that cater to smokers?
I don't. I think that, you got to remember, you'll see all these 760% signs out there. First of all, it doesn't tell you it's a tobacco tax. Second of all, it doesn't tell you that the people funding it are the tobacco industry. And so they want to keep deadly product addictive here in the state of Missouri and to have it as cheap as possible. And so I think that, that's an unfortunate thing that voters may not know, that this is being funded, again, the opposition is being funded by the tobacco industry.
What kind of reactions have you felt from local businesses that are saying that this 760% tax is an actual thing?
We've actually had a huge amount of business support throughout the state of Missouri because they want to see the funding go towards elementary and secondary education and higher education. The only thing we've seen is some signs and a few gas stations. Not all gas stations in the state of Missouri have it, but we have seen it since we've been on a 24 bus tour. We've been to a lot of gas stations. And so, we don't see that there's going to be a huge impact to them because they're still going to be able to sell tobacco and, Missourians are going to buy it. They're just paying a higher tax.
What have big tobacco manufacturers said about this?
They do not want to see people to stop smoking. Essentially, they want to keep a cheap, deadly, addictive product here in the state of Missouri as cheap as possible.
This is the third time the tax has been on the ballot in Missouri. What measures are you trying to take to make this more appealing to voters in this time around?
I think there's numerous things that we did. We did this in the initial part of it. First of all, we structured the measure so that the money would go towards elementary and secondary education, higher education, and tobacco prevention and cessation. The previous two measures were going towards Medicaid reimbursement rates for hospitals. So I think the way it's structured is completely different than the previous two measures, and I think it's key to remember that, you know what, we were the lowest tobacco tax in the country now, and we weren't back then.
You mentioned earlier you've been on like a 20-city bus tour. What other approaches have you been taking to promote this piece of legislation?
We have been going to community groups for over a year now, and we've gone to Rotaries, we've gone to Kiwanis groups, we've been to every group possible. We've been trying to obtain endorsements. We're running a full-fledged campaign to get Missourians aware of what the benefits of Prop B is in their community.
What events has this campaign going to be taking part in to spread this objective?
One thing we'll be in the homecoming parade at Mizzou. We're going to be in other homecoming parades across the state. And also, we're going to be going door to door and calling voters and letting them know what the measure does and how it can benefit them.
Thank you so much for your time.
Thank you so much. Appreciate it.